My name is Hannah Williams. I'm a nurse psychotherapist. I work in a children's hospital, mostly with teenagers that are brought in for hospitalization. The problem I see mostly among the age range between 13 to 18 is bipolar disorder. I've diagnosed about 75 cases of severe bipolar disorder over the last year. There are two types of episodes that you can have, which is manic and depressive. Manic comes with high energy that elevates over days. You usually have some delusional thoughts, loud speech, and very bad hyperactivity. Then there's the depressive episodes, which have fatigue, insomnia, suicidal thoughts, and loss of appetite. For this treatment, I usually recommend medication if long-term counseling fails, and I usually recommend long-term counseling along with the medication just so people can keep track. There was one really bad case that I have removed the patient's name for privacy. I will refer to her as patient A. She showed severe signs of bipolar disorder along with mania, paranoia, and psychosis. She was 17 years old. She's a 17-year-old female. She is of Caucasian descent. She comes from an upper middle class family. Her previous health history has been of 3 recorded suicide attempts to cause her stomach to get pumped, and the last one was stitches. I recommend hospitalizations for the individual until she reports feeling better or she has been approved for release and her symptoms are under control. I also recommend medication taken once a day to help with manic and depressive episodes. I also recommend long-term counseling twice a week so she has an outlet and someone to keep track of her mental health. I recommend that to treat this disease, the medical community as a whole make sure that the stigma around it gets lost, because bipolar disorder is a lot more common than we like to believe. And we also need to work on finding alternatives to medicine, because sometimes that does not work for people, neither does counseling. And it also is very difficult to diagnose this disease, so in case the diagnosis is wrong, we shouldn't have medicine be the first plan of action, but it is important that the patients get long-term care to make sure they can live effective and happy lives.